the director of the Division of Geriatric Psychiatry here at SUNY Downstate Health Sciences University, in addition to the director of our Alzheimer's Center, the Center of Excellence for Alzheimer's Disease, the director of our Geriatric Psychiatry Fellowship Program, and the director of a really cool geriatrics education program called the Brooklyn Initiative to Develop Geriatrics Education. I spent all day, every day, working with older adults and helping our students, residents, and fellows learn to work with older adults in a way that's healthy for them, in a way that improves their quality of care and makes sure that they get the outcomes that matter to them, that what matters most to the older adult is the care that they receive. So it's my pleasure to be here with you all today to talk a little bit about aging and caregiving. It's my first time speaking on a microphone outside. So if there's any feedback, please let me know. Okay. So nice to be here, and it was nice to follow the Alzheimer's Association. I also want to give a plug for the Alzheimer's Association, both in thanks for them being here today, and for any of you all here who are in the audience that may have a family member or a friend that has Alzheimer's disease or another kind of cognitive impairment, a memory disorder, please consider reaching out to them and getting care for that friend or family member. They know a lot and can support you through the journey. Their resources are outstanding, and we appreciate the partnership that we have with them. So pleasure again to be here to talk a bit about aging and caregiving. This talk is focused on our community members to help you understand a little bit about what is normal aging. What is normal aging and what it means to be a caregiver. Some of you who may be trending towards late life yourself may also find yourself in the role of not only being an older adult, but also being a caregiver for another older adult. And it's important to understand how you can not only maintain that role as a caregiver, but also to maintain your own health. If you're not healthy, you won't be able to care for your person that needs help. So pleasure to be here to talk a bit. It's a pleasure to be here to talk about normal aging, when things are not normal aging, and caregiving. So first, I just want to emphasize, for those in their community that maybe weren't aware, we live in an aging world. The US population and the global population are all trending towards a higher percentage of individuals in each population being made up of older adults. By 2060, it's estimated that the US population will be about 23% of individuals 65 and older. Versus only about 15% back in 2016. More and more older adults will be here living in our communities, and it's important that we all understand how to care for ourselves and to care for our elders. One of the questions that comes up a lot when we give talks in the community is about aging in general, and about how long an older adult can expect to live. What is the actual lifespan, and how long can I maintain healthy living? And while we don't have a clear idea about the exact age that individuals can live to, we know that some individuals have lived to exceptionally high ages. The longest lived woman is a really interesting French woman named Jeanne Calment, who died back in 1997 at the age of 122. And there have been reports of many other adults living into their hundreds across the US and across international settings. The current oldest living person is Tomiko Itoka. She's 116 years of age. And I think in the US sometimes what happens is we become obsessed with the number. We become obsessed with how long can I live and lose sight of the quality of our. And so I'm here today to say that it's not just about the age that we reach, but it's about the quality of our life, how we reach into these later years with good health. So we think in general that the maximum average lifespan for folks globally is about 115 years. That's about how long folks may theoretically be able to live. And the statistical absolute upper limit is probably a little bit higher than that, but that's purely statistical modeling as to how we understand how long people can live. But more importantly, we want to talk about how we can achieve successful aging rather than just longevity. So here in the US, we define being an older adult as being someone 65 and older. But there are many different subgroups of living into later life that are important to consider as well. And each of these different subgroups have different considerations that your clinician, your provider, your physician may consider when working with you, including the young old, the oldest old, right on up into centenarians, folks 100 and plus. There additionally seems to be times as we experience and go through our life cycle when we maybe have periods of accelerated or paroxysmal aging, when our biological clocks accelerate slightly. This seems to happen at around the age of 44 and again at the age of 60. As we increasingly understand more about the biological processes of aging, it's important that you work with your providers to understand as you reach these life milestones that at different ages it may be important to discuss how you can maintain healthy aging, engage in preventive care, and engage in wellness so that those periods of paroxysmally accelerated aging are experienced in a way that minimizes their impact on your quality of life. There are lots of considerations that you should have as you move through the aging process, and you move through the aging process with your friends and family members. There is, of course, an increase in overall physical limitations and other limitations as we age. There's an increase in the percentage of folks that experience disabilities, difficulty seeing, difficulty hearing, changes to mobility and communication, and of course changes with memory or cognition and self-care. This overall raises the overall chance that individual older adults and the population at large will have more of what we call non-communicable diseases as the population ages. So we're going to have more older adults as the population continues to age into the coming decades, and these older adults will have more and more chronic and non-communicable illnesses. And it's our job as providers, and here at SUNY Downstate, all your providers in the community, to minimize the number of non-communicable or chronic diseases that you experience. Please engage with your providers to discuss all of your conditions. Just speaking in general about the aging process, so for our older adults in the audience today, it's important to understand that there are lots of lenses in which you can consider the aging process. And engaging with each of these different theoretical platforms to understand how you can maximize your successful aging. There are, of course, genetic contributions or evolutionary contributions to how each individual experiences aging. About 1/3 of the overall aging process and longevity is related purely to your genetics. The remainder comes down to how you've lived your life, physiologic processes and psychosocial processes, your occupation, your habits, whether you smoke, drink alcohol, whether you engage in regular exercise, whether you engage with your community and your faith-based organizations to make sure that you have social connections. All of these different impacts into how you live your life contribute to the overall aging process. And individuals that maybe don't contribute daily, put sort of money in the bank of their healthy aging bank, may experience more accelerated aging than folks that do contribute to their healthy aging bank on a day-to-day basis. The more that we exercise, the more that we socialize, the more that we continue to learn new things, the more healthy we will be as older adults and minimize how many illnesses we have. Another common question that comes up when we give talks in the community is, what are the actual normal changes that happen in my body as I age? What is normal and what is abnormal? And so there are some things that we've come to expect. Of course, there are some brain-related changes that are important, but they're often not what people in the community think to be normal age-related changes. It's very common in communities around the country for people to think that Alzheimer's disease is actually old-timers disease, meaning that as we age, it is expected for us to lose our memory. It is expected for us to slow down and become forgetful, but I'm here to tell you that is not the case. While there are some changes to how we think as we get older, in particular, we tend to slow down in processing speed, meaning we don't think quite as quickly as we used to when we were younger. That doesn't change the quality of our thinking. It doesn't change the accumulation of knowledge that we've had throughout our lives. All of that remains. It becomes crystallized and continues on into later life as long as our brain is healthy. As long as our brain is healthy. There are some other changes that occur also to brain health, mainly surrounding small changes to working memory and other forms of cognition. There are changes to our skin, of course, as our skin thickens, the top layer of our skin and the under layers of our skin. Changes to our sweating. We develop a decreased ability to sweat, and because of that, a decreased ability to regulate our body temperature. Our immune system slows down a bit, and we develop a decreased ability to fight off infections and diseases. And this is why it's really important that you engage with your primary care providers and get that preventive care, get your vaccinations to fight off these illnesses before they take hold. It's important when we're young, and it becomes very important again when we're older. Our cardiovascular system changes a bit as well. There's a reduction in cardiovascular capacity as the structure changes in our heart and blood vessels. And our endocrine system changes a bit. There's a reduction in our hormone production, including a decreased ability to regulate our regular body processes or physiology. Changes to how we modulate our temperature, changes to how we move from sitting to standing. Everything slows down a little bit, and we just have to learn to accommodate so that we don't experience falls or experience illness when there are rapid fluctuations in our environment. And of course, body composition. There are changes that overall lend themselves to a decreased amount of muscle mass and an increased amount of fat tissue. So it's important, if you're not doing it right now, to start combating these changes. If your regular weightlifting is not a part of your daily routine, in addition to walking, it should be. Weightlifting helps regulate our body. It helps maintain muscle mass and decreases the amount of fat tissues we have so that we can age healthy and maintain our mobility and not fall. And of course, there's changes to our respiratory system. There's some changes in our overall efficiency in taking in oxygen and using our lungs to adapt to exercise conditions. Our skeletal muscle changes and our digestive system slows down a bit. This in particular is very important to realize as our digestive system slows down. This impacts a lot of your day-to-day process. You may feel full earlier, and that may lend itself to you eating less and unintentionally losing muscle as well, rather than adapting to the changes that are happening in your body and eating small meals more frequently. It also means that when you take your medication, you may find that they take longer to take effect just because it takes longer to process the medications as they enter your body. It doesn't impact the overall effect of your medications. It does just mean that they may take longer to get to the level in your bloodstream than they did when you were younger. So you have to just expect these things and accommodate for them, especially depending on which kind of medication you're taking. And there's some changes in your urinary system, a reduction in your kidney filtration abilities, which may lend themselves to just an overall slowing down in how quickly you create urine. And again, changes to your bone density and some increases in, of course, inflammation in our joints or arthritis. A lot of this can be combated by starting in your early and midlife by engaging in a regular exercise routine and a pattern of healthy, non-inflammatory eating plans, like the Mediterranean-style eating plan, or more recent eating plans like the Mediterranean diet combined with the DASH diet or the MIND diet. Very healthful diets that may improve your quality of life and may or may not improve your longevity as well. So it's sort of helpful to think about aging and all the processes that we were just discussing as, you're sort of walking along the axis of time, right? We emerge sort of perfect at birth and we march along through time, and we are born with a certain amount of genetic predisposition. We have our genes, we can't change them currently, and then we go through life and we incur our environmental exposures, right? We may drink alcohol, we may smoke cigarettes, we have jobs that may be dangerous sometimes or expose us to things that may not be perfect for our bodies. And all of this is sort of wrapped around how we live our lives socially, how we engage with our friends and families, how we engage in our life overall. And at each different time point, we may experience different amounts of stress. These stresses lend themselves to contributing to the aging process. We lose different parts of our system. The more illnesses we have, the more infections we have, the more that things happen to us. And the more that happen to us as we move along, the less we're able to accommodate for further changes as we get older. And this lends itself, of course, then to the age-related chronic diseases that some of us accumulate. Healthy living today, starting now, if you're not doing it, is how you age healthfully in the future. Start preventing rather than dealing with the problem once it's occurred. And there are a host of things that can happen when things have gone wrong. We call these the geriatric syndromes, in which illnesses, stressors, events have caused some changes to our overall body systems. These syndromes can cross multiple body systems and it can impact the daily quality of life of older adults. There are a host of syndromes, these geriatric syndromes, and many of them can impact mobility, they can impact your medications, they can impact quality of life, and most particularly your functional independence. If you've reached, or your family member or friend has reached a setting in which they have one or more of these geriatric syndromes that are on the screen right now, it's really important that you engage with a geriatrician or a primary care provider that is equipped to handle one or more of these syndromes to make sure that your care is optimized and we can move you back towards a state of health. There are a lot of resources here in Brooklyn for those of you who have friends, family members, or yourself that are experiencing age-related phenomenon, geriatric syndromes, illness, or in general feel that they're not aging as healthy as they can. I'm happy to say that SUNY Downstate Health Sciences University has an excellent primary care department. In addition to geriatric specialists, geriatric psychiatrists like myself, in addition to other partners in the community, including some really important health insurance partners, as well as a nearby primary care organization, Oak Street Health, that does an outstanding job working with older adults who have Medicare and are interested in having primary care services. I'm going to change gears just for a second and talk about caregiving. Caregiving here in the United States is a remarkably prevalent unpaid occupation. So caregiving is something that happens when one of our friends or family members becomes ill past their ability to care for themselves, requiring somebody to step in and kind of fill in for those daily activities, right? We have more trouble bathing, more trouble going to the bathroom, walking on our own, getting to appointments, taking our medication. Someone has to be there to help. I'm experiencing this myself as my parents are getting older, and I'm having to step in a bit more to help them. And it can be very, very stressful. Caregiving here in the U.S. can be anyone, spouses, adult children, parents, other family members, friends, and of course there are paid caregivers that work as home health aides or other positions. There's about 53 million Americans here in the U.S. currently providing unpaid care to persons 65 and older. This is expected to grow to 73 million people by 2030 as the population continues to age. Remember, we talked about our aging U.S. and global population. And the value of this unpaid care is expected to be about $470 billion at current rates if it were fairly compensated. That's an extraordinary loss to our individual pockets and to our U.S. economy. Very, very difficult for families to manage this. 58% of caregivers are women, so not only is this very burdensome to be a caregiver here in the U.S., but is also the weight of being a caregiver is not distributed evenly. It tends to fall more on the women in our population. And unfortunately, this is kind of learn-on-the-job sort of occupation. There's minimal training available for family and unpaid caregivers, so it's an unsupported, very stressful job. And it's important that you understand that there are places that you can go to get help. If anyone in the community is experiencing stress of being a caregiver, we're here for you. This is the graphic up on the screen right now is just showing the overall distribution of states that have the most unpaid caregivers here in the U.S. And you can see that New York is one of the highest percentages in the nation as far as individuals providing caregiving services, most particularly unpaid caregiving services. We know that this is happening here in our community. Many of our staff, our physicians, our nurses, and our administrative support team, all of our staff, are currently acting not only as high-functioning individuals at Downstate, but also serving as caregivers at the same time. Very, very tough. So not only financially burdensome, being a caregiver is really very burdensome to an individual's health. We were talking a lot about maintaining your health, having an exercise plan, engaging in preventive care. Being a caregiver really puts, being a caregiver puts a really large burden on your personal physical health. You have very difficult time maintaining an exercise routine, eating healthy, getting to your own doctors when you're a caregiver. And you can see here from the graph that I'm showing that there are, across the nation, the number of unhealthy days and obtaining insufficient sleep is remarkably prevalent for caregivers in the U.S. About 15% of caregivers in New York State are experiencing a high number of unhealthy days and insufficient sleep on a regular basis. The number of individuals who are caregivers also have higher rates of chronic diseases and disability. About 37% of individuals providing care to persons living with dementia or other chronic illnesses have disability and chronic disease statuses themselves. So not only financially burdensome, difficult to health, but also lending itself to increased rates of personal disability. So these are things you have to get ahead of. Again, just like your personal health, you have to prevent rather than treat the problem that you're looking at. Stress from caregiving can come from all different sources and cause different problems. It leads to worsening of current health problems and causes new health problems, causes mental health problems, leads to insomnia and loss of sleep, and decreases your recreational and occupational productivity. So overall quality of life really takes a big hit. So these are the tips. As a caregiver, it's going to be very easy for you to try always to put your person, your recipient of care, the family member, the friend first. And that, I'm here to say, is not the path you should take. You have to put self-care first. Caregivers cannot care for others if they get sick. Once they get sick, they need care themselves, and they will become the recipient of care rather than a caregiver. And there may not be someone available to do that for you. You have to learn how to identify stress early. What are your personal symptoms of stress? Does your sleep get disrupted? Does your mood dip? Does your appetite skyrocket as you start to eat more sweets? We all have our different coping mechanisms. Mine is sweets. I love them. When I'm stressed, I eat candy. It's terrible for me. You have to learn to identify them and get ahead of them and have a plan to manage that stress. A healthy eating plan that you stick to no matter what. Daily exercise, maintaining your sleep. Spiritual outlets. One of the more common things that happens to caregivers in my Alzheimer's center is that they stop going to church. They lose their connection to their faith, they lose their connection to their friends at their spiritual organization, and they become depressed. They lose that connection and they feel guilty for not connecting with their faith. You have to maintain hobbies. Caregiving is not a hobby. It's not a hobby. It may feel like a hobby, but you need to have hobbies outside of caregiving. And you need to speak with professionals when needed, when things get a little too far. Counseling is available. There are support groups available. The Alzheimer's Association has extensive support for all caregivers in the community, for people who are caring for those living with Alzheimer's and related dementias. And you have to be ready to accept help from others when it's offered. Caregivers very often want to do everything themselves. They want to be the perfect caregiver for their recipient of care. And this lends themselves often to refusing care when it's offered, often to their great detriment. And you need to stay socially active. Caregiving can be extraordinarily isolating. Social isolation is already a national public health emergency, and being a caregiver with social isolation, I would say, is an extra level of that emergency. So there's lots of places you can go to get help. This slide set will be available. I think that this talk is being recorded, or any of our services here at Downstate would be able to direct you straight to caregiver support services that you may need. One of my personal favorite is the New York City Department for the Aging has multiple sources available for you all to gain access to support. Their older adult centers are wonderful.
VA Harbor Health has a caregiver program.
And I'm hearing that the VA New York Harbor Healthcare Program also has a caregiver support program for veterans and their families, which is wonderful. The Department for the Aging has specific caregiver support programs on site at their older adult centers and many other resources. There are also the New York State Caregiver Support Initiative programs. This is specifically focused on folks that have Alzheimer's disease and related dementias, but they have support programs all over the 5 boroughs focused on support groups providing respite services, connecting people to the necessary insurances to get home health aides, setting up financial planning, advance directives, and all the things that caregivers need to keep their recipient of care and themselves healthy. In particular, we have a partner here at Downstate, Sunnyside Community Services, that has caregiver support specialists on site in our Alzheimer's Center, and they're ready always to provide support to whoever needs it when they come into our clinic. Again, I mentioned the Alzheimer's Association. There's another similar organization called Caring Kind that also has excellent caregiver support programming. And there are things like adult day programs, programs where folks can go to give their caregiver a break, right, during the day so that they can go out and attend their own appointments, attend to self-care. And there is a program in New York State called CDPAP that allows for unpaid caregivers to convert themselves to paid caregivers. They're allowed to receive some income for their daily work, caring for their family member. This is really important. We all wish it was a little more money to support them day to day, but it is a step in the right direction. And New York State has an excellent program that was developed in the last few years called the Nursing Home Transition and Waiver Program. This program is specifically designed to keep folks out of the nursing home. When their caregivers are stressed, they can't handle the level of care the person needs. This program can step in and provide up to 24-hour home health aide care to divert that individual from having to go into a nursing home. Really, really important and special program. New York has taken some excellent steps. And here at Downstate, we have our Center of Excellence for Alzheimer's Disease, where we provide comprehensive care to the person living with Alzheimer's disease and related dementia, but also have social workers on site that can provide caregiver support services. And there's so many more. There are programs all over the city trying to do a good job for our older adults and for our caregivers. Now that we've talked a little bit about caregiving, I want to just wrap around and say one more time, re-emphasize my points about how we can age well and how you can hopefully avoid becoming a recipient of care yourself and keep your recipient of care healthy. Please maintain a healthy diet and weight. limit your toxic exposures. There probably is no safe level of alcohol consumption. Alcohol includes wine, it includes beer, and it includes liquor. All of those things are considered alcohol, and any amount can be deleterious to your health. Cigarettes are equally deleterious to your health, and any amount of cigarettes can cause a decline in your ability to breathe correctly and increase your risk of cancer and other illnesses, including chronic obstructive pulmonary disease. If you or a friend or family member need help quitting alcohol or cigarettes, we at Downstate are here to help you get yourself into a healthier lifestyle. And of course, regular cognitive activity is also really important. You shouldn't stop learning as you get older. We all have to keep learning. You have to try to learn new languages, learn an instrument, learn to use the computer, learn to use your cell phone, learn new things. Your brain is like a muscle. The more that you use it, the stronger that it will be, and the better you'll be able to ward off the harmful effects of aging. And of course, engaging in regular preventive care with your primary care provider. Exercise, when we talk about it, just to be very specific, means even low to moderate intensity exercise. So getting your heart rate up to 100 beats per minute for about 30 minutes a day. So 30 minutes of walking per day has extraordinary benefits in decreasing your overall chance of developing disease or dying. Engaging in regular social hobby activities and cognitive activities, and being with your friends and family whenever you can. These last few slides are just a plug for the important programming that's going on here at Downstate. In case anyone listening to me speak wants to connect to these programs or wants us to come speak at any of their spiritual organizations, their older adult centers, we're available to come and talk to you whenever you'd like. We have here at Downstate a program called the Brooklyn Initiative to Develop Geriatrics Education. This program has partnered with all of the colleges and schools in here at Downstate, Kings County Hospital, one of our federally qualified health centers, and multiple of our local senior center organizations like the Fort Greene Council and Raices to provide really important educational programming with the goal of transforming healthcare and the workforce here in Brooklyn to be age-friendly and dementia-friendly. We're trying to help everybody understand how to care for older adults and how to age healthy. We also have our Center of Excellence for Alzheimer's Disease here at Downstate. This is a program that's really special. It's particular to New York State. New York State has opted to create a Center of Excellence for Alzheimer's Disease program. There are 10 centers around the entire state that are funded by the Department of Health to provide gold standard diagnostic, treatment, and education services for Alzheimer's disease and related dementias. This program is available here right in your community at our center. We provide 2 to 3 hour comprehensive evaluations for people with memory changes. We're very happy to help anybody that wants to come in and get evaluated. This includes all the necessary testing, education, caregiver support services, and everything else that you might need. Downstate is here to help improve your health, and I'm happy to be a part of that as the director of that center. This is our contact information in the Alzheimer's Center if anyone finds that they need help or they know someone that needs help. And thank you all for listening to me on this sunny day as I rocket my voice across the whole street. Thank you all. Have a good day. Thank you. Do you have any questions?
No, I heard.
Yeah.